Medicare and You Handbook 2020. What's in there? Is there anything useful? Yeah, there is. We're going to talk about that in just a minute. Hey, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Let's talk about Medicare and You 2020. This is a book that Medicare sends out every year to folks that are on Medicare. For those that are new to Medicare, they also get one too. This year's model is about 125 pages, broken down into 11 different sections, and there's a lot of really good information in there, but nobody ever reads it. So here's what I'm going to do. I'm going to give you a summary. If you still want to go ahead and read the book, I would suggest that you do. But if you still want to go ahead and read the book, you certainly can. Maybe use it as a truth serum, see if what I'm telling you is right or not. But in any event, I'm going to give you a summary, and I'm going to do, there are 11 different sections, and at this point, I'm planning on doing 11 different videos on it, on each section, or one video on each section. So let's just jump into it and see. Medicare Section 1 basically gives you an overview of Medicare. Medicare Part A is hospital inpatient health care coverage. Medicare Part B is hospital outpatient. That's things like doctor visits, labs, x-rays, MRIs, CAT scans, emergency room, ambulance, and all of your health care that comes out of the hospital, outside of the hospital. Medicare Part C is now referred to as Medicare Advantage. And one thing that you'll find is if you read through the material almost from the very first page, what you'll see is that Medicare is trying to push you into the Medicare Advantage world. They're trying to get you off Medicare, original Medicare, with no networks and no referrals and all this other kind of stuff. They're trying to get you into a managed care plan that is where you get your Medicare benefits from a private insurance carrier. Oh, what fun. And they're doing this because it saves them money. They put all the risk off on the insurance companies, and so they don't have to deal with you anymore. Well, you decide whether that's worth it or not. But they will tell you things like, and they'll do things to kind of frighten you just a little bit. They said original Medicare has no limit on out-of-pocket expenses. That's true. That's why most people will buy a Medicare supplement plan, because that does cap your out-of-pocket expenses. A G plan, for example, caps your out-of-pocket expenses currently at less than $200 a year. Medicare Advantage plan, which is managed care, with most of the plans that are available in Georgia, about half of them are HMO, the other half are PPO, which means you really have to play by their rules. You have to go see their doctors and their hospitals if you want your claim covered in full. And most of those plans will limit your out-of-pocket at $6,700. Okay, it sounds like a lot of fun. They will also point out original Medicare does not have drug coverage, but the Medicare Advantage plans do. Yeah, most of the Medicare Advantage plans have a plan that's baked into their plan, and it may or may not be something that you need or want, but it's there anyway. With original Medicare, as I mentioned earlier, you can use any doctor, any hospital, anywhere in the country. But if you go over to the Medicare Advantage plan, they give you a list of doctors whose names you cannot pronounce, and they say you need to use these folks if you want your claim paid in full. Okay, then it gets into how much does Medicare cost, and Medicare Part A for most folks. And by the way, you have to have both Medicare A and B before you can get either a supplement plan or a Medicare Advantage plan. Medicare Part A for most folks is no charge if you have at least 40 quarters of what do they call it? Significant wages, I think is what, that's not the term. But anyway, if you have at least 40 quarters substantial earnings. That's what it is. Substantial earnings with Medicare. Medicare Part A costs you nothing. The Medicare Part B does have a premium currently in 2020. Yeah, I still said 19, didn't I? Currently in 2020, the Medicare Part B premium is $145. So you have to have both A and B in order to get either a Medicare supplement plan or an Advantage plan. There are late enrollment penalties if you don't do it right, but basically with original Medicare and a supplement plan, and by the way, I don't have a Medicare Advantage plan. I'll never have a Medicare Advantage plan. I have over 500 clients all over the state of Georgia. Every one of them have original Medicare and a supplement plan. They wouldn't have it any other way, and I won't either. So, by golly, at this point, if you're wanting a Medicare Advantage plan, you need to talk to somebody else because I'm not going to help you with that. So, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute, and this concludes Lesson 1 on Section 1 of the Medicare and You Handbook 2020. You take care and have a great day.